Each year, millions of Americans face the reality of living with a mental illness. As the United States approaches 2 full years of the COVID-19 pandemic, mental illness and the demand for psychological services are at all-time highs, especially amongst children. Now, according to the CDC, 1 in 5 children had a mental health disorder, but only 20% of those children received care from a mental health provider. May is Mental Health Awareness Month. So all week long, 10 TV is making it our mission to provide support, educate, and fight the stigmas surrounding mental health. Joining us now live, Dr. Ariana Howitt with Nationwide Children's Hospital. Good morning to you, Dr. Howitt. Thanks for joining us.
Good morning.
First, let's start with Operation Conversation. What is this campaign all about?
So Operation Conversation is all about empowering the adults to start conversations with the children in their lives. So On Our Sleeves, we created tools and strategies to get that conversation going and started, but most importantly, keeping it going. How do I respond and react in a way that builds a positive and trusting relationship between me and the child?
And I think getting that conversation started is the hardest thing to do. So what are your tips for parents that are looking to start that?
Absolutely. So we want to first set the stage, make it a habit, pick a time in the day where there's low distraction, your child's more likely to engage and talk with you. Maybe even have their input. Ask them, what time do you want to talk? What do you prefer? And if you do it at the same time every day, they know it's coming. And then you start by asking open-ended questions. And that's what we provide On Our Sleeves. We give you a lot of ideas of questions you can ask just to build that habit that are fun, or questions that can be a little bit more serious about thoughts, emotions, or when you're worried about their mental health.
Yeah, great resources all available to parents in our area. And speaking of parents, do they have to start their healthy habits first to talk about emotions and mental health first with their kids?
That's a really good question, and absolutely. If we model talking about emotions and how we cope with those emotions, kids are learning, they're watching. So definitely a good thing to start in those conversations.
So it's been a long 2 years for a lot of families. A lot of kids have been, pent up in their homes, not getting out a lot. So what are some of the signs that maybe parents could look out for in their children as we continue to do more in-person events or activities and get back to a more normal life, Dr. Howitt?
Sure. It's exciting to get back to normal life, but it's another change that kids are adjusting to. So we want to look out for any signs that they're stressed about this change and adjustment, any changes in behavior, withdrawal, irritability, just not interested in the things that they used to be interested in. Those are all signs that maybe something is stressing them out, and we have to ask and engage in that conversation.
So let's say you have had the conversation, you've started it, you're noticing some of the signs and symptoms. What do you do as a family?
So that's where it's really important that our reaction to the conversation is positive so that children feel supported. Letting them know that you're there for them, you support them, asking them what they want to do before we jump in with a lot of questions and advice, and really just listening and letting them guide the conversation until they're ready, and asking them, are you ready to hear what I have to say? Are you ready for some of my advice? So that, again, they're feeling like they're being listened to before we have a lot to say.
Dr. Howitt, thank you for coming on this morning and starting the conversation with us this week.
Thank you for having me.
Of course. Now, looking ahead to the rest of the week, we will look at how the pandemic has impacted mental health, screens, social anxiety as well, determining a diagnosis and response, and resources available. For a full list of coverage, head on over to 10tv.com and you could click on the Mental Health Matters link.